You're live.
Good morning, everyone. I'm Dr. Shalini, Consultant Fertility Specialist at Hebbal Center, Bangalore. Today, we're discussing about understanding PCOS. So, what is PCOS? Or previously, it was known as PCOD also. So, it is a polycystic ovarian syndrome in which we usually a woman present with irregular periods. They have excessive hair growth over the face, acne, and probably in the lower part of the body, well, much more than normal the hair growth is. And the third one would be on a ultrasound we see a picture of PCOM, that is multiple cyst-like uh, follicles are seen, which is seen in the ovary on a ultrasound. So PCOS is affected in about 1 in 10 women. That means if we see 10 women now, and at least one of them will be having PCOS. So it is an endocrinological disorder where the hormones in the body, which is FSH and LH and androgen, they are abnormal. So let's look at irregular cycles, because we know that irregular cycles means people can vary their definition basically. So if at all a woman misses her period, or she gets her period a little early also, they say it is irregular. It is not so. So when a person has got her period before 21 days, before she completes 21 days, or if she gets her period after 35 days of a cycle, in a cycle, so that is when we consider it as abnormal. Or if at all she's not got a period for a minimum of 90 days or 3 months, that is also considered as irregular cycles. So can we say that, in a young woman who just attained her menarche, or she just started her periods, she might be having this kind of a cycle, abnormal cycles. Can we call her PCOS, or, it's abnormal? Actually, we can notice that, okay, it may not be normal, but we cannot say that, she's a PCO, she has some issues like that. Only upon 1 year of completion from her start of a period, we can further evaluate if she's still continuing to bleed after 45 days, she gets a period after 45 days, or she gets a period before 21 days also. That is when we may have to further investigate and look at it. Otherwise, and if at all a woman or a girl has not reached her period even after the age of 15 years also, we consider to be abnormal, and we need to investigate further. So, what are the common causes of irregular cycles? One is fluctuation in the hormones. It could be happening because of a medication, because there are people who take medications, especially progesterone, which is for the withdrawal. That means people used to postpone the periods, or to get their periods early according to their occasions. So they use inadvertently of these medications. Because of that, they can again cause irregular cycles. The other factors could be environmental factors, stress, and some other drugs also, and eating disorders also cause uh, these irregular cycles. So, what causes PCOS? When we're looking at PCOS, one is genetic. We do see that a woman who had, her mother or sister is suffering from PCOS is generally at a risk of suffering from PCOS. We cannot exact why do you think it would be genetic? We don't know. It could be some genes which are passed on from their mother or their grandmother, or it could be that when the mother is pregnant with this girl child, she would be exposed to high amount of androgen, that is a male hormone which is in the mother's body, is exposed to the baby. So then because of that, they are at a higher risk of PCOS. So when they start developing in their life, and then they have certain hormonal changes can be happening in itself, or because of the lifestyle or environment, again they will go for a PCOS. The other thing is definitely a environmental cause and lifestyle causes, where the obesity is one of the leading causes, or eating disorders. these are the things which can further enhance PCOS, or we can see the symptoms of PCOS. There can be people who are at risk for it, but it develops only upon probably by putting on weight, and or it could be because of the food habits which they have changed at a point. So this is the uterus, picture of tubes and ovaries. So basically, a woman, whenever she menstruates, the lining which is there in the uterus is what she bleeds, and after about 3 to 5 days, it starts regenerating back. So why are we looking? So this is a picture of the uterus. This is a picture of the uterus, and this is a picture of the ovary. The ovary will have multiple follicles at a certain point of time. These are the ones. What do you mean by follicle? Means, so we don't usually see the egg on a scan. So what we see is the follicle which contains the egg. Egg is microscopic, so we can see the follicular development on a ultrasound. So basically, when we are born, or even before we are born with about 6 to 7 millions of eggs when we were 5 months or when we were 20 weeks of gestation. So once we are born, it drastically decreases from 6 to 7 millions to 1 to 2 millions of age. And by the time we attain puberty, it's only around 3 lakh eggs which are there, which diminishes with age. So we do see here that from birth to menopause, there is the period, optimal fertile period, when we say is that it is between 20 to 30. That is when the eggs are more, and the quality are more. So when we're looking at physiology of, basically I would want to discuss about menstruation, because to know what is abnormal, we need to know what is normal here. So from the brain, that is hypothalamus, there is a hormone which is released, GnRH, which acts upon the pituitary, and it helps us to release the FSH and LH. These are the major hormones which play on the ovary. So with this help itself, the ovulation is going to happen. That means for development of the follicle and ovulation, all of these are related to these two hormones, FSH and LH. So upon acting on this, the estrogen and progesterone are the hormones which are released. So in a ovarian, that means a menstrual cycle, initially when she starts bleeding, that is when her cycle starts. So at that point, the FSH is released from the brain, which helps the growth of these follicles. So there are a good number of follicles in both ovaries, out of which only one follicle starts developing. So this is dependent upon which follicle is getting attracted to the dosage of FSH which is being released, and that is the one which starts growing also, and the rest of them, they actually die. The one which starts growing, it takes about a few days, probably, we cannot exactly say a 14th day. For some women it can take some 10 days, it could be early, or some people can take even up to 20 days for the development of follicles. So after that, because of the LH release, the egg is being released, and this follicle which is there, it becomes a corpus luteum, which produces the hormone of progesterone, which maintains the pregnancy if a pregnancy has happened. So here what is happening is, in PCOS, the FSH and LH hormones are abnormal, and because of this, there is no development of follicle at all. So when there's no development of follicle, the hormones, so the lining keeps growing, and there's no development of progesterone, production is not there later. So because of which, what's happening is, in a normal cycle, follicle ruptures and the rest die. Here, these follicles which are there, they keep on accumulating in the ovary. That is why we say it is a polycystic. That means they look like cysts, but they're not actually cysts. These are the follicles which contain eggs. They are not dying, they're not growing, they're just there stagnant in the ovary. So it looks like a multiple cyst. That is why the name of polycystic ovarian syndrome. So this is a picture of a normal ovary. When you look at this second picture, it is the picture which shows multiple follicles. So it is a typical picture of a PCOS woman. So when we're looking for the diagnosis of PCOS, we look at three things. One is abnormal periods. Second thing is hyperandrogenism, that is male hormone is being more. So what can it cause? When the male hormones are more, it causes acne over the face. It can be even in the body also, abnormal hair growth. It can be excess in certain areas. Can be on the face, chin, upper lip. It could be in the medial part of the thighs. And again, it can cause male pattern baldness. So these are the signs, symptoms which we see in a woman who have PCOS with a hyperandrogenism. And the third one is again PCOM, that is on an ultrasound, we see the picture which we have shown. So out of these three, if any two are there also, we can consider them as a PCOS woman and we can treat them. So the other things which is going to be affected in a PCOS woman, what are the things which gets affected? Do we say that, okay, the irregular cycle is the only thing which is happening for a woman of PCOS? No, there are other things which are happening. So that is, one is insulin resistance. Here, the insulin is a hormone which actually helps the glucose to convert, send to the cells for its, energy. So what happens here is that the insulin, the cells which are there in our body are resisting to insulin. So there, the sugar levels will go high, and at the same point, the insulin also will go high because the body is thinking that insulin is not being sufficient. So when the initial insulin is being increased, at that point itself, there are other changes which are happening in our body. So one is we are more prone to diabetes. The second thing is obesity is one of the things which can happen. I mean, it's a cycle basically. So it can start initially or it can start after there is a hormonal imbalance also. And whenever this insulin resistance is there, we are more prone to eating a lot. So when a high insulin levels are there, we feel like eating a lot. The appetite is increased. So again, this can lead to further obesity, and further the cycle of PCOS continues. And the other one will be depression. We do see that a lot of women with PCOS have depression or other mental health issues. So this is something which they need a lot of support. It could be from the family, it could be from a friend. If at all that's not been happening, they could meet a psychologist regarding this if at all they are suffering from depression due to PCOS. And the other thing is endometrial cancer. A woman who has PCOS is very much prone to endometrial cancer. Why is that? Because the estrogen is a hormone which is being produced in the body, and there's no progesterone which stops it, and then we're getting our periods. So estrogen increases the risk of endometrial cancer. So how can we prevent it? So at least we say a woman needs to have her menstrual cycles, that means her periods, at least once in 1.5 months to once in 2 months, at least, so that she gets minimum 6 cycles of her periods in a year. So when we can do that, there is a drastic decrease in, we can decrease the risk of endometrial cancer in a woman with PCOS. Last but not the least, infertility is also one of the leading causes. In PCOS is one of the leading causes in infertility. The next thing is obesity. As I've told you, because of various reasons, women who are either obese may have a higher risk of developing PCOS, or basically who are at risk, they have a higher chance of obesity. So it's a vicious cycle unless we start or stop something. That means it could be a diet modification or by means of a exercise. Somewhere we need to start the changes. So once that sets in slowly, we can reduce weight and improve our PCOS also. The other thing is fertility issue. Why? Because there's no ovulation happening here. There's no egg which is being released. So because of this, people face fertility issues also. And almost about 85% of the women with fertility, especially with the ovulation disorder, that means whenever they're having irregular cycles, not all women with irregular cycles have PCOS. No, there are only about few of them. That is 85% of them do have PCOS, and the rest are other disorders. Because of this, it is one of the leading causes of female fertility with the ovulation disorder. So what else can happen for fertility? Okay, we have conceived the child, but what can happen further? Is it going to stop only at that? No, sometimes they may experience a higher risk of miscarriage. or they can have preterm births. And again, during their lifetime or during their pregnancy, they can have high sugars. They can develop GDM, that is gestational diabetes mellitus, which can come down post delivery, or they may develop diabetes in their later life, or hypertension, that is high BP levels. The other things which they can develop is non-alcoholic fatty liver disease, or endometrial cancer, as we previously discussed. The other things which they can develop is heart disease, is something which they may be developing. So how do we handle PCOS? So the first step would be realizing that, okay, diagnosing the PCOS by means of their symptoms as well as an ultrasound. So once that is being diagnosed, the next step is diet. Diet has to be planned well, where we can decrease the carbohydrates, increase more of proteins, and small amount of fats needs to be involved. So depending upon how we take it and how often we take it, and the how what is the quantity of the meal we are taking also, by changing these things we can improve our PCOS. The next thing is, I mean, when we do exercise, it could be a walk. I mean, a small walk of 20 minutes per day, can help us increase the metabolism rate in our body, further enhances the, PCOS can be stopped. I mean, basically, it can be maintained. There is no cure for PCOS, but it can be maintained. So these are the two ways which we can maintain in our life. If at all a person is suffering from infertility, along with these two, the next step would be, we can go for a follicular monitoring. If at all a woman is experiencing to have periods, delayed periods, it could be a 40 days, 45 days. In such women, either a either a ovulation is happening, or there is a delayed is not happening, or a delayed ovulation is being seen. So in such cases, we can go for follicular monitoring and see that whether she's ovulating or not, whether she requires any medications. The next step would be to give her certain medication so that she ovulates on her own with oral medications. And once the egg is being released, we can monitor through follicular monitoring and ask them to try naturally. Any questions? No surgery is necessary. Usually, surgery, that is what we say. So first thing is diet modification and exercise. The next step would be, if people are planning for conception, then you plan for ovulation induction drugs, or certain medications, injections may be required in very few people. But otherwise, in a person who is not planning for a pregnancy, the only thing is they need to get their periods on time, at least every 2 months. So take medications prescribed by the doctor so that you get them. And only in very, very rare cases, I think initially it was being done, which is called ovarian drilling. But now it is not of a significant, where we have other modalities rather than going for a surgery. Yes, I cannot exactly pinpoint out and say bad lifestyle will lead to a PCOS. I would say it is one of the factors, along with other factors where, if at all you're at a risk of PCOS, yes, definitely the bad, or I would say unhealthy lifestyle, which could be in form of diet and no exercise, can lead to PCOS, and it can further affect our day-to-day lifestyle also. Not will having a PCOS affect the outcome of my IVF? Generally, there are instances where a PCOS, a very severe PCOS, where their AMH is very high, which shows high resistance, can affect a oocyte quality, but not necessarily in every case. Thank you.